Hi. So today I'm going to talk about sex problems and solutions. Don't we all have sex problems? I think we do. And I really want to take this time to, first of all, identify, say, what is sex? Okay, so we know sex is any activity involving sexual stimulation. Okay, so the definition has really changed. It's really, really modernized, and we need to update the dictionary and actually explain to the dictionary, right, what this new definition of sex is. But it's anything that causes you to be aroused. There is some sexual activity there, okay? Now, what's the problem with sex, right? I think we all have problems, some degree of problems with sex. And it's okay to have a problem with sex, right? It is okay because we're humans. We are not infallible. We actually have to have things that are not perfect. And I really love the fact that we're not perfect because it gives us that variety in life. We are able to enjoy the differences, learn the differences of one another, especially in the bedroom, right? But here's the question: do you really know if you have a sexual issue? And it doesn't have to be a huge issue, and it may be a huge issue. It doesn't really matter. The key is, do you ever think of improving your sexual performance, your sexual knowledge? Do you ever think of having a sexual problem that needs to be corrected and studying it or getting help to fix it, right? Okay, so the first thing I want you to understand is sex. Sex is okay, okay? Sex is natural. The birds, the bees do it, we do it, everyone does it. So it's important to understand that it is here to stay and we want to enjoy it when we do it, all right? Yes, there's this question of should you have sex before marriage, right? I personally believe, and again, all these opinions I have are my own personal opinions. There's no book, there's no studies or statistics on it. Just please understand, this is just my humble opinion that I'm sharing with you through the years and years of experience that I've had practicing medicine, okay, as a doctor, okay? So it's important for you to understand that sex is to be enjoyed, and sex before marriage is something that you can decide. Personally, I do think sex before marriage is okay. But if you have your reservations, please wait till you're married. It's just that, you know, there are issues that can happen in the marriage, right? And again, I really believe it depends on how important sex is to you, right? I have that five chronological order of sex, brains, looks, money, heart. You have to understand which one is the most important to you so that you can put sex where it is. And if it's not important to you, okay. If it's important to you, then it's going to be something that you're going to want to focus on and make sure you have great sex before you get married. So that was just a side note. So having a idea of what sex is, it can be anything, okay? We can go from one end to the other. So the most important thing is let people be them. Let them do them. Do you and they'll do them. Respect each other's differences. It's important. Just love one another as we are and accept who you are. So that's important, who you are sexually. Okay. So the question I always ask, coming back to this question, is do you have a sexual issue at all? And I'm going to say it again. I think we all do. We all have reservations. We all have things in our brain about sex. And we always question our performance, right? And we want to get better, I hope. That's why you're listening to me, to try and make sure you enjoy it and have the best sexual experience of your life every time you have sex. Is that possible? No. But you can enjoy it, right? Depending on who you're with. So the first issue I have with sexual problems is size. I get a lot of that. People always want to know, does size matter? And personally, size does matter, but sometimes it doesn't matter. Meaning, if it's a sexual problem in terms of size. You have to find someone that matches your size. Now, is it easy? No. Like I said, I really want to find a device that I can tap on your arm and then I can tell you the size without even looking, without even taking off your clothes. And that device will make me rich, right? I really want to go to China and make one, right? But everyone says, Kathy, you're crazy. So I'm leaving it alone right now, but maybe in the future. But I do think that we should know each other's size before we even say anything past, let's go out to eat or something. One should know because people say, studies say that on the third date, people are having sex. It changes. I think that's more of a current study. But the most important thing that you got to realize is that the size does matter, but you have to be honest with your partner. So, depending on your size, can you improve it? Yes. Solution would be if it's something that you're bothered about, see a specialist, usually a urologist, that actually can improve the size, the looks of your penis. But we are all aware of anything that you do can have side effects. It can have long-lasting side effects, so be careful. For men, if you want to improve the size of your penis, be careful because it can affect the sensation. For women, the same thing. When we want to change our vulva, some people call it the vagina, it's actually the vulva, the lips, the tightness, it can take away the sensation because some of the nerves are cut. So the size of the vagina, remember my V-test, right? Go put your fingers in the vagina, open up, see how wide you go. You don't want to go too wide because if you go too wide, it's too big. And then you want to know the length by putting a ruler up there and making sure that you can put a condom if you want to, but putting a ruler up there and measuring the length of the vagina so that you know what you can accommodate. And sometimes I say just add 1 inch because you actually balloon or you actually elongate when you're aroused sexually. So it gets a little bit longer and a little bit wider. So the most lovely thing is that you can accommodate different sizes. And sometimes if you're too large, it's hard to grip. So people will always want to say, Dr. Kathy, should I get some tightening? Should I get some laser? Should I have some surgery? And I'll be honest again, this is me, my personal humble opinion. It depends on how bad it is. If you've had 10 kids and the vagina is open, loose, just something that you can't work with, I would say see a Uro-GYN, get an opinion, see whether your pelvic floor muscles are loose, falling, and get them repaired if you're healthy. And of course, your doctor will decide that with you. But there are ways of tightening the vagina and the pelvic floor muscles. Remember the Kegel exercises. So you really want to pay attention to whether you are loose or not. All right, ladies, I'm talking to you. The guys are not going to tell us. They don't tell us. Why? I guess they don't want to upset us, right? So I'm telling you from experience that whenever you are trying to measure the size of your vagina, sometimes if you're lucky, the guy will tell you, but a lot of times the guy won't. So it's up to you to keep those exercises going and speak to your specialist and do my V-test. Again, finger up, open up. If it opens too wide, it's too big. It should really be a little bit tight, hard to open up. And then measure with a ruler the length of the vagina so that you know, what you can accommodate. All right, so that problem is, remember, do you know the size? Do you know what you can accommodate? If a guy is 10 inches and you're 4 inches, it's not going to work, right? Even though it can, depending again how much you balloon, how much you open up, how much you actually enlarge. So you have to sort of sometimes test it out and see. So from your experience, you'll know, oh my goodness, this is something that I really cannot accommodate. But if you can, you'll know whether you can. If you can't, you'll know whether you cannot, okay? So when it comes to size and it comes to looks of the penis and the vagina or the vulva, you really want to, first of all, accept that you were born that way and that it's beautiful. But if you want to enhance it, there are risks, okay? We do have women that have different sizes of lips, different sizes of clitoris, different sizes of the vagina. I've seen lips that are very long. I've seen lips that are very short. I've seen lips that are, irregular. I've seen vaginas that are, again, different shapes. We have a museum in New York where there are so many different sizes and shapes of vaginas. There is a huge display over there in New York. I want to go there one day and show you guys. And I understand they're opening one in Miami, so there'll be one in Miami. I can't wait because Miami's closer. But I will go there and show you guys that there are so many different sizes from all over the world. They send pictures to the artist and they get all these different sizes and they're able to display and show you that from across the world, numerous, uncountable, thousands of vaginas that have different shapes. That means that you really want to allow the shape or the color or the looks of the vulva, vagina, to be natural. And guys, you have to sort of like love it. And women, we have to love the penis, okay? And I'm not going to go deep into that because I know sometimes it's a challenge, but depending on the size, depending on the color, depending on the shape, it can turn you on or turn you off. If it does, make it clear and make it known, and don't hurt anyone by saying anything rude, but you will just be honest to yourself and then just make your way and say, okay, you're out, right? But you first of all have to identify what you like, and you're not going to know unless you try it. And even though I say that, I'm going to say, give it a try. You will never know. It might be worth it, right? So just try and understand that we're different, accept our differences, love our differences, and know that it's okay to be different. It is so okay. I had a guy that had two penises, okay? Now, when I say I had a guy, I had a patient that had two penises. I've had women have two vaginas, two uteruses, two sets of ovaries, and she got pregnant in both, uteruses, or should I say uteri? But both of them had the baby. So they had fun. The couple had fun, and it's very important to understand that we are basically what we are. We're born the way we are, and we're not going to be born the same, and we're not all going to be born perfect, and I don't think there's such a thing as perfect. We're going to have those variations on the spectrum, remember. So it's important to know that no matter where you are, we are all okay as long as you're functioning and you're healthy and you're able to enjoy one another, okay? So remember, even that guy with the two penises is having a great time. And if you're not, come see me, okay? Because you really should be having a great time. All right, so that is one of the problems. Being able to identify that your body part is beautiful. Accept and love it. That's the problem and the solution. All right, another problem and that I see a lot in my practice is the psyche, the brain. Okay, there are so many reasons why the psyche can be a problem sexually. The first one is we're all crazy, right? I think you all know that, right? Every single one of us is crazy. And I don't say that lightly because I used to think that I was not crazy, but now I know, we're all crazy. So there is a degree of craziness, though. There's mild, moderate, severe, very severe, and way over there severe. You don't want to be around the people that are very severe. You want to be around the people that are mild. So always look for the people that are mildly crazy. And of course, if you're severe, make sure you're mild too. And that means you have to identify your quirks, your psychological issues. Are you a narcissist, or do you have the traits, right? Are you selfish? Are you aggressive? Do you listen to people at all? Do you communicate well? So these are things that will say, maybe I have a problem with ADHD, right? So if you're not able to focus, you might have ADHD that's undiagnosed. Or you might be depressed, right? Depression is very common, bipolar is very common, and that is where you'll find that people are not really paying attention to their depression. It's important to look at whether you're depressed because that will also be a sexual issue that will come up in the bedroom because you're going to have no motivation, okay? So that lack of motivation of anything can actually affect your activity sexually. You really want to take that time and get an evaluation by a psychiatrist or psychologist or a therapist. And if you need to get treatment, get some treatment. I do have herbs that I recommend for depression, but again, you'd have to be seen as a patient. But there are ways of treating without prescriptions, but a lot of people do need prescriptions because it's cheaper to use prescriptions than supplements. It's very important and very expensive to use supplements. But you'll see that depression is very common and misdiagnosed a lot. I have a lot of patients that think they're okay, but they're depressed and they are in denial. They do not want to even say the word depression. Again, taboo, how they were brought up, okay? So the issue here is, are you depressed? If you are, and I'm saying that the lack of motivation, if you're just not getting up and you're not able to do things lovingly and with fun, you're probably depressed, okay? And again, get that evaluation. There are different questionnaires that you can fill out, and you can even go online and see some of them and see whether that's something that you need to address. Because once you address it, whether with, again, herbs, supplements, or prescriptions, or even just with therapy, you'll actually feel a lot better and be able to have a better sexual encounter with your partner. Now, even though I say that, let me say this. I've heard that sex with a crazy person is woohoo, wild, fantastic. I've had some patients, they can't get divorced because the sex is so good. So, yeah, I've heard that. Does it ring true? And the reality is that they're probably much freer in spirit and freer to do things in the bedroom when they have a lack of inhibition, right? So if you have a lack of inhibitions, you're going to be able to be just I guess experimental in the bedroom. And I know that that can be scary for some people, but for people that love it, I think it's fantastic. Each person has to understand how far they're going to go sexually, and of course, communication is key. And if you want to have sex with someone that is crazy, make sure it's not the crazy that will get you into trouble. Okay, just please beware. Okay, you have to make sure that the person's not gonna, do something and put you guys in jail. Okay, so just a warning there. But I do know that having sex with someone that is nuts is really fun, but don't try it. I wouldn't suggest it. Okay, all right. The other thing that I really get a lot of issues in terms of sexual displeasure is looks. I have a lot of patients that say, "Oh, I'm overweight. I don't want to have sex." Being overweight, I don't think is a problem in terms of sex. It's your self-image, your self, insecurity. Are you insecure? And that is where I've met women that are beautifully overweight and they're just beautiful women and they're having great sex because they're really not only in love with themselves, but they take care of themselves. And I'm going to say a word of caution. No matter what you look like, you've got to love yourself. I'm going to say that because it is so crucial, because we can see it when you don't love yourself. If you walk around and we look at you, we know whether you love yourself, right? We know by how you look, we know by the aura you emit. You are actually emitting energy when you are confident and when you are in love with yourself, okay? So if you cannot love yourself, you cannot love anybody else, okay? I know that when you're on an airplane, if there's some need for oxygen, when the masks come down, and you know this too, you put the mask on who first? You put the mask on yourself first. Then you can help more people. Because if you put the mask on other people, you're going to pass out and you can't help more people. So you've got to put your mask on first. Just like you have to love yourself first so you can love other people, so you know how to love other people. So your looks should not be an issue. Even though I know it is, get over it. If you're going to get some counseling, get the counseling and accept your looks. But then again, the other solution would be to change your looks. If you are overweight, get on a diet program, exercise, lose the weight. If you want to have a certain hairstyle, if you want to wear certain clothes, even if you want to do things in terms of uh, tattoos or in terms of piercings, you can do things that will emphasize your beauty, but then again, do it tastefully, right? You really want to have class when you do these alterations. Even surgery, I know surgery we can do things, but you got to be careful because that is a risk. We know people get into some horrible situations when they're doing surgery. So again, make sure you do your research on those doctors, intensive research with them so that you know who you're going to choose. But yes, we know we can get the boob job, we can get the butt job, and we can actually flatten the tummy and so much more. But there's Botox, there's lasers, there's so many options now with cosmetic surgery. So you can improve your looks, women, and guys, you too. You guys go get a pedicure and manicure too, and you guys can go and have surgery too. I know there's a doctor in out west that is actually creating all sorts of perfect bodies for men and for women, right? So again, you can indulge, but my suggestion is love yourself the way you are, confidently, because people will see it. And that can be a sex appeal that you won't even realize, okay? But if you have that feeling ugly look, we're going to see it. So try your best to move into that direction of having a love for your looks, okay? Another issue I see with problems in the sex in the bedroom is diseases. All right, and that's a straightforward one, right? Diabetes. If you have diabetes, it's going to be hard to perform sexually because of the sugar damaging the nerve endings and the circulation, the arteries in the penis. So we want to make sure that the diabetic patient has a very well controlled sugar, okay? The better control your sugar, the better you'll be able to function sexually. So get your sugar checked. If you have any sensation issues, get your sugar checked. And I want that sugar down to 70. That's a fasting blood sugar, okay? But sometimes the sugar will already be too high. You're a diabetic, and there are ways that you can improve the nerves. So look at ways of improving the sensation and see whether you can get more sensation into your penis or the vagina, of course, for women that also have those issues. The clitoris is very, very sensitive, but sometimes with sugar, it can get less sensitive. So important to look at diseases, diabetes, hypertension, autoimmune diseases, heart disease, cancer, anything that will cause you to go down needs to be addressed. Otherwise, you're not going to have great sex in the bedroom. And the reverse is true. If you're not having great sex in the bedroom, look for a disease, look for a problem, look for why you're not having sex in the not having great sex, because there's probably a link to something going on that you have not found yet. Okay, and yes, there are asexual individuals, right? There are people that don't have sex. I'm not really talking to asexuals right now. I'm talking to those that want to have great sex in the bedroom. Okay. Another issue I see is lack of communication. Lack of communication. A lot of my patients will come to me, couples, one will say, I'm not having great sex. The other one will say, oh, my sex is fine. And then you try to bring them together and they are not being truthful with each other. And they're living in sexless or marriages or partnerships. And it's really, really unfortunate because they're not able to communicate. Sometimes they try, and I'll do some coaching and some counseling with them, but a lot of times there are hidden unmet needs that they have that they're unable to share with their partner because of their upbringing or their background or things that have happened to them in their past. Things that have happened to you in your past should stay in your past. Get counseling, get help, leave that luggage behind so that you can be in the present with your partner and know that that person needs to be treated so well, and to treat them well, you've got to be honest with them in terms of how you are, what you want, your needs, so that they can actually fulfill your needs. Okay, so communication is key. If you don't communicate, learn to communicate. I have a friend, he's a psychologist, and he says communication is the most difficult skill to learn. And I said, you mean you can learn how to communicate? He goes, absolutely. That there are courses you can go for. So if you need to go for a course, go for a course to communicate. And guess what? We all have communication problems. We should all go for courses. That's what the psychologist says. We should all go for courses. So try and look for a course if you have to. But first of all, acknowledge, accept that communication is key and it can be difficult, right? So you've got to identify if you say something to someone and they don't understand, take your time, be patient, and say it in a way that they may understand. Otherwise, you'll have a problem with describing and conveying your needs to your partner. Okay, so that is something that you want to do. Get some help, get some classes for communication. Another problem that people have in terms of do you have a sex problem is fear and anxiety. I have people that have panic attacks, people that have phobias, people that can't drive alone, people that can't go out to a party alone, can't go to dinner alone. There are so many inhibitions that we have that lead to this fear that will stop us having a great time in the bedroom. I had a patient that would tell me that whenever her partner came in, she would take the picture of Jesus on the wall down and cover it up. And when he left, she would put the picture back up. She had a fear that the eyes were looking at her and frowning at her. And so she was not able to, have her orgasm in that place because she always had this fear. No matter where she was, she just felt those eyes were staring at her. So that's something that she must have gone through as a child, something that, made that impression on her. Or maybe she had a lot of pictures of Jesus in her room or in her house. But it's really, really something that you have to address so that you don't carry that, again, that luggage into the current relationship. So there are things that you have to make sure that you've left behind and you don't bring it into the relationship. And sometimes you don't know that. So if you don't know that you have ideas or ideations that are really, really impacting your sexual performance, you're going to have to sort of like sit down and figure out, what do I believe? Is it true or is it not true? Okay, so sometimes you're going to study yourself and say, I'm going to do some research and find out if this is true. I'm very good at that. I love asking questions. So ask questions. 1 + 1 is 2, right? Yeah. So we can prove that. So sometimes the other things that we learned as children growing up, they said it to us and we really don't know if it's true or not, but we heard it and it's implanted. We need to remove that plant and get it out of our brain so that we don't have that impression of fear or anxiety, okay? Anxiety, panic attacks is one of the most difficult things to treat. But there are medications, there are herbs for the milder anxieties. But when you have anxiety, you're not going to be able to relax unless you get some sort of treatment. And I'm going to encourage you to please get treatment because anxiety is fixable. You can get that anxiety under control and have a great time in the bedroom, okay? But first of all, identify that you're having those anxieties or those fears and address it so that you can relax. And I'm not saying everyone's going to have a problem in the bedroom with anxiety and fears, but I'm saying if you have that problem, identify it because you want to be able to relax and be in the moment in the bedroom when you're having sex, okay? Another problem with, sexual problems, not knowing whether you're having this problem is lack of knowledge. So if you don't know something, ask. A lot of people just assume the answer is one way and it's not the answer. You've got to be able to ask, again, part of what I said before, and dig and find out whether it's true. Okay, there are a lot of myths out there, right? So you have to debunk those myths and realize that, okay, it wasn't true. I was wrong. Or my mother was wrong. Or my grandmother was wrong because they said things to us. Y'all know this. That really hurt us, right? Some of us, it really destroyed us. And some of us are still suffering up to age 85, 86, 96, 95 because of that. So very important to first of all understand that if you have a lack of knowledge, it's your duty to look for the proper answers. Because if you just allow anything to go into your brain, you're going to not be able to take it out and you're going to have misconceptions and you're going to have a horrible time dealing with people because they're going to be arguing with you and you're going to be arguing with them and then you won't be able to have a great relationship. Okay? So get to the bottom line, find out what are those ideas that you have that are wrong and you don't know about. Ask questions, learn about it. For example, hormones. I am big into the hormones, right? Testosterone, estrogen, progesterone. Y'all know, I talk about it all the time, if your hormone levels are low, you're going to have no sex drive. Very simple. And I see a lot of that every day in my clinic. Low T, low testosterone levels. Please get your testosterone levels checked, estrogen, progesterone, there are other hormones too, so that you can at least know and identify if you're having a sexual issue because of low hormones. Because once you bring it back up, life will change, okay? It'll get much better. Another issue that I find that people are in denial of, people that, don't want to talk about it, is, of course, your sexual identity. I am really, really, really someone that believes that you've got to let people be. This life, we're all different. We all have to respect one another, love one another. So please, whatever the sex, the gender, the identity that you choose, allow it to be for that person and be for yourself. And be honest with your partner and let them know how you feel if you are not honest. If you're honest, okay, you're good. But if you're hiding it from your partner or pretending, please don't do that. I'm imploring you. Be honest. Tell your partner because life's too short, right? As my sister says, we're stardust. We're here for a brief moment, so you really want to enjoy your time with someone and not deceive them. And karma can come back and hurt you too, so please be honest. So that self-identity takes me to the kinky, the fetishes, the porn. These are things that people need sometimes to be sexually aroused because they become addicted to it, right? So you don't want to become addicted. If you're having addiction issues, that has to be addressed because that's going to interfere with your functioning daily activities, and you don't want it to affect your daily functioning. So please, if you're having those issues where you're becoming addicted to anything, know that you've got to get help and stop ignoring it. I had a patient that came to me and he said that he had some blood in the urine. So I said, okay, let me do some tests. And he goes, yeah. But Dr. Kathy, before you do the test, can I tell you that I masturbate 80 times a day? And I said, 80 times a day? He said, yes. I said, why? He said, because my wife is a pastor. I'm a pastor and my wife is a pastor. And so she doesn't believe in sex but once a month. And so he started masturbating, and next thing you know, he became addicted and he's masturbating 80 times a day. So I said, okay. Let's try 40 times a day. Okay, let's go down to 40. He came back the following week. I tested him and he still had blood in the urine. And then I said, okay, let's go down to 20. And then let's go down to 10. And let's go down to 5. It was at 5 times a day that the blood in the urine stopped, okay? But he had to, tell me this because, again, he had a fear and he didn't realize that what he was doing was actually hurting him. He had the addiction. So I had to slowly get him off of it. Of course, I did send him to a psychiatrist to get some help. But his wife, I never got to speak to her because he decided that he didn't want to share that information with her. But he was happy that he was able to get the blood out of the urine and get his addiction addressed. It's not easy, but it can be done, okay? So, religion, that's a big, difficult one for me. Religion is something that I'm going to always say this. Take religion out of your sexual activities. Now, I'm going to say that for those that want to have sex. If you're okay with not having sex, you can keep your religion and do whatever the religion that you're in says. But you have to separate it because I really, and this is my own belief, I really believe that the religion is not there to teach you about sexual activities in depth. They'll give you something, but they're not able to give you everything that you need when it comes to sexual activity in the bedroom. It is between two people, but if the two people are very different, or have issues, you really can't go to the Bible and or whatever book, Quran that you use, and actually find these answers because sometimes there are medical issues that need to be addressed. So leave religion out when it comes to certain problems that you're having. But if you have no problems, you're fine. Do any religion that you want. But those that have problems, please get some help if you want to improve your sexual function. Okay. Again, each person's religion I respect. Follow it if you have to. But for those that have issues, if you are allowed to, please come and get help so that we can help you without talking about religion so that you can get your answers and repair or resolve the issues that you have medically, if it is a medical issue. Friends. Friends are going to be the ones that are going to always say things to you about what happened in the bedroom with them and what happened with that person. Please be careful. They all exaggerate, right? We know that. But just be aware that they can plant seeds. Don't take them seriously. Do your due diligence and find out whether it's true or not, okay? And the last thing I'm going to talk about is your own beliefs. And I think I touched on it in the earlier part of the conversation. What do you believe? That is so important. If you are someone that believes one thing, I'm going to encourage you to do one thing for me, okay? Step out of yourself. Step out and look from the other perspective what the person's saying. I'm serious. See whether you can step out of your own body. I'm saying literally step out. Okay, I know you can't really step out, but I'm saying get that body out and step over there and look back and say, how can I look at it from a different angle? And get the person's help to help if you need it. Because your own beliefs might be wrong. Okay? Now, is it gonna, make or break you? No. But it can really keep you back if you have beliefs that are wrong or, twisted, right? So if you are having issues with beliefs, and I'm saying things that you had when you were bringing up, when you were brought up, things that you were told, um, uh, even sometimes your mind, if it's psychologically not stable, you'll be thinking things, hallucinating things, and seeing things. Please get that addressed. Get checked out. There are ways that we can screen by looking at certain tools and certain questionnaires that you fill out for us, and we can help you in terms of making sure that your brain is thinking logically and correctly. Because if it's not, you're not going to be able to have any relationship with anyone, because that person's going to be upset by how you believe things and how you relate things to them. So it's very important, if you're having belief issues, get some help. If you need to go to the church, go to your religion, that's fine. But belief issues need to be addressed, especially if you have a partner that has different belief issues. You want to sort of have similar belief issues so that you can join and be one, okay? All right. I know I talked a lot today. I'm going to talk about another sexual problem next week. But in the meantime, I really hope that I helped you with have some of these tips, and hope I'll see you next week, okay? All right. Have a good night. Bye.